Cancer. It's a word none of us would like to hear. But there is a scarier word: relapse. Everyone knows early diagnosis is very important for cancer patients to increase survival rates. But what people might not know is that it's equally important for those who are in remission. 3/4 of ovarian cancer patients relapse, with an average survival between 5 to 20 months. But relapse isn't just about these numbers. It's about the fear of entering a hospital frequently. It's about the anxiety of waiting 2 days for a test result back. Today, we're here to solve this. We are here to detect relapse earlier, to increase survival rates, and to get rid of that anxiety. But how? How are we going to do this? We're going to implement a point-of-care device to the current monitoring pathway for ovarian cancer patients that will not only detect relapse earlier, but improve the performance of the current standard. And what if I told you, on top of all of this, that you have all used this device and become somewhat of an expert? It's our friend, the lateral flow device. And the truth is that for the past 2 years of our lives, we have all been using it. So all of you, better than anyone, know that it's easy to use, that it's quick, and that it's cheap. But we need your help. We need £4.5 million to conduct a clinical trial. With your investment and our effort, we can all save lives together. My name is Alejandra Mones, and thank you for giving me your time.
Okay. Carlos, what would be the biomarker you'd be looking for with the lateral flow?
So we're looking at 2 biomarkers, CA125 and HE4.
And yes, we've all spent the last 2 years doing lateral flow tests, but doing lateral flow tests which in typical times would probably not pass, certainly in the US, to be used by normal people. They wouldn't pass clear waving, they wouldn't be acceptable for general public use because they need a certain level of expertise. So how would you address the kind of making it really user-friendly?
Yes, so it's basically a fingertip blood sample. That's why it's mainly user-friendly. And you just drop the blood sample, hence why it's easier. But it would still require, for example, like a local GP to read it. But it doesn't require like a normal blood test that now they do to take the photos.
Thank you. So just to ask more question on that, the local GP will be using it. So practically, am I understanding correctly? It will not be the customer who will be using the patient, but you will need it to be used within a GP setting, right? With your doctor.
Yes, so we're still looking if you could either take it at home and then take it to the doctor, or if you can just take it at a local doctor yourself instead of going to the specialist.
I see. Okay. And you mentioned that you would like 4.5 million. Can you go a bit into detail? So you'll be conducting clinical trials. Anything else? Like for how long will that 4.5 million last, and what will you be using them for?
Yeah, so to be honest, that number, we're still kind of looking into it because it's mainly based on research of this kind of
to develop
clinical, to develop it. So it's more based on this current sector, normally how much it is, but we're still looking into it to be able to tell for sure.
Okay, all right. Thank you.
No worries.